Chapter 24, Infectious Disease and Sepsis. Let's start talking about the diseases, and then we'll go from there into the reaction to the diseases, which ends up in sepsis. So talking about how diseases are spread, we need to understand what causes diseases. We got bacterial, virus, fungi, other microbes. I think anybody that's been alive the last year and a half understands infectious diseases and how they're transmitted. Typically, it's with direct contact, hand to hand, body to body. We also have contact with secretions. That is the main mode of transmit for COVID. The secretions that you exhale get on other objects and you pick them up and get them into your body. Could be aerosolized into the air or onto a surface. That's why we have been teaching everybody to wash their hands finally. When infection causes illness, it doesn't start off with symptoms. We have an incubation period where your body is trying to figure out what's going on with the disease. It starts causing problems and your body starts having their immune response. In that incubation period, you can spread the disease before you actually have symptoms. That's why when we're looking at people that may have been exposed to COVID, we look 24 to 48 hours before they started having symptoms to see if there was any potential exposures outside of their normal family interactions. Factors that influence the exposure, the virulence. Did the Delta variant of COVID is supposed to be one of the more transmittable. The dose, how much were you exposed to? If you get one drop of a contaminated source on your skin, that's a lot different than getting a whole bucket full. The route, if you get stuff on skin, you've got very good protection against any outside substances, but if you ingest it or inhale it, it goes into the bloodstream much faster. Then we also have to worry about the body's resistance. If you've had a vaccination, you've developed the antibodies, which can give you some resistance, or you may have some natural resistance. Maybe your body has been exposed to a similar disease before, and so it knows what to look for and knows how to react. So you've got some natural resistance. So those are the things that affect how the infections impact you. We also have to worry about our comorbid factors. Is everybody familiar with COVID? People that have chronic lung disease, people that have diabetes, people that have compromised immune systems already have a harder time dealing with the reaction to COVID. So that's another factor we need to be aware of here. So let's talk about sepsis. Sepsis is a life-threatening condition from an abnormal and counterproductive response by the body that causes damage to tissue and organs. So basically, it's the immune response system that doesn't react like it should. It has a reaction that causes tissue damage, organ failure, loss of blood pressure. You actually go into shock and hypotension because you don't have the ability to maintain your fluid volume. The bad part about the damage that it causes, this hypovolemia, is that you don't fix it by giving fluids. So it makes it really difficult to treat. You have to treat the infection and reverse the damages before you can actually get their blood pressure back to normal. So it's not a quick fix for anybody outside of the hospital. So different ways the body gets the infection. You have the local infection, one body part, one system. The body immune response takes over. You get the white blood cells. It attacks the pathogen, and everything's good. If you get a systemic infection, you start having anaerobic metabolism. You get the anaerobic or the lactic acid productions. The white blood cells get confused and damaged by this response, and then you start developing sepsis. Once you start getting the accumulation of lactic acid and other chemicals in the bloodstream, you have vasodilation, increased capillary permeation, so you're leaking fluid into into the interstitial areas, and that's what causes hypotension. When we're dealing with sepsis, we're looking at the lungs for our pneumonia. That's one of our bigger causes of septic reactions. You get a pneumonia that spreads throughout the rest of the body. Abdominal surgeries or pancreatitis, all common causes of septic shock. Genital urinary, kidney and prostate infections, urinary catheter insertions. So where would we see patients that have multiple catheter insertions? Something to think about when you're dealing with patients and trying to figure out what their cause of their illness is. Some long-term catheter insertions, people that are on medications for a long time, maybe chemotherapy or other type of medication administration. Tracheostomies because of the infections, because you can't cough out as much. G-tubes, pressure sores. Pressure sores are bed sores. It's when people lay in the same position too long and they develop an ulcer, decubitus ulcer. That's why you see them turning people every 2 hours when they're in the hospital. We've developed an assessment tool called the SIRS, Systemic Inflammatory Response Syndrome Criteria. Body temperature is going to be lower than 96.8 Fahrenheit, or higher than 101. So you can have some extremes based on how the body's reacting here. The heart rate over 90, respiratory rate over 20. So the body's compensating a little, but not a lot. You got a blood pressure over or lower than 90, and new onset, altered mental status, and worsening mental status. All clues that we're having a septic problem here. Once you're in the hospital, they're going to do a quick sepsis-related organ failure assessment, or QSOFA. It's nothing that we're going to worry about. It's in the hospital. It's more predictive on how long they're going to have to stay in the ICU or their likely mortality. So it's something you may run into if you work in an ER, but it's not a pre-hospital assessment tool. So what we're going to look for are signs of infection. If you have a septic alert program in your system, be very familiar with it, because what we want to do is identify these people, let the hospital know they need to get aggressive, and provide treatment as quick as possible. So some select common communicable diseases we're going to talk about here. What we want to do is understand what they are so we can prevent them, so you don't get sick from your patients. You need to make sure you have all your appropriate vaccinations. Hep B is the common one that's required by OSHA for anybody working with bloodborne pathogens. And they are working on making COVID-19 vaccine required by OSHA, so we're getting close to another one there. But think about making sure you have your flu vaccine, just to give you that extra advantage, so if you get exposed to it. Start asking questions about your patient. Have they recently traveled anywhere that may be experiencing other diseases? If they just came back from Western Africa, where they've had Ebola outbreaks, or have they came back from other countries that have different levels of outbreaks? Have they had their vaccinations? And this could be as simple as a child that hasn't had their childhood vaccinations, and they're coming down with symptoms of mumps. So if the patient is sick, understand what they're going to be going through with their symptoms. Mainly, if they've got an infection, they're going to be having elevated temperatures and feeling pretty poor. So wear your PPE. If you have to wear a mask, put a mask on. Do everything to prevent your exposure. If you do get exposed, make sure you get tested and treated. They may give you some prophylactic antibiotics, something to just make sure that you're not catching any diseases from your patients. So chickenpox, this is a common one that kids get all the time. It's caused by the varicella zoster virus. That's something you need to remember, because that shows up on national registry tests occasionally. Signs and symptoms of the chickenpox. Usually just like the cold, except for the fever and the rashes. They have little spots or pocks around the body. It's very contagious. It's not life-threatening, but you need to be aware of it. Uh, Used to be that they had chickenpox parties for kids so that they could all get it and get their antibodies built up and not have to worry about it again. I don't think they do that anymore. It's probably not one of those good things to be doing. That's what the chickenpox looks like. Little spots all over. They itch really bad. And it's just supportive care. Treatment, isolate them, keep them separate, make sure you're using your PPE when you're taking care of them. They do have antivirals that will help reduce the extent of the virus. And then they do have a vaccine that you can get so you don't catch it. So hopefully we're getting our kids vaccinated from that one. You can get the post-exposure vaccine. So if you've never had chickenpox, you can ask for that at your next doctor visit and see if you can get that. Or you could get the vaccine right after you get exposed. Measles, also called rubella, highly infectious viral disease. So with viral, it means your antibiotic's not going to work. Fever, cough, eye irritation, white or bluish white spots inside the cheek, and then a red spotty rash. So it's white spots inside the mouth and red rash on the outside. There's your red rash. It's a little bit more pronounced than the chickenpox. They occasionally have outbreaks of this around our communities here. Most recent one I heard about was up in Denver. They had a whole group of kids at a daycare come down with the measles. Easily spreaded. Um, you get that contact with the nose and mouth secretion, so we know kids wash their hands really good. Hopefully COVID has reduced our incidence of this now because of everybody getting taken care of. So now we have vaccinations for this. That's been out for a long time. If you do have somebody that has measles, mumps, rubellas, you get them quarantined and use good hand washing. The mumps is a paramoxiovirus. It's very similar to all our other diseases here with muscle aches, loss of appetite, headache. You get swelling to one or both of your parotids, and it lasts about 7 to 8 days. So that's in your neck there. So you have the swelling in the just below the jaw there. Here's the swelling. It's transmitted by droplets, direct contact with saliva. Once the vaccine or the symptoms start, you need to quarantine the patient 5 days, and they usually get better on their own. So typically they don't end up calling 911 except if they're having difficulty breathing. Hep A. It's a general term for any hepatitis is a general term for liver inflammation. The Hep A virus causes fever, nausea, loss of appetite, malaise, abdominal pain, jaundice, and it's usually worse the older the patient is. There's the jaundice in the eye. That's a telltale sign for us. And the skin is kind of yellow looking too, but the eyes are really pronounced there for you. It's spread from fecal to oral route. They did have some outbreaks here in El Paso County over the last probably 3-4 years, and they were basically fecal to oral, but they were sexually transmitted diseases at the local adult bookstores. There's no specific treatment, it just runs its course, but once you get it, it's there. Prevention is good hand washing, good hygiene. You mainly see it in outbreaks from restaurants, from fecal to food transmission off of poor hand hygiene. There is a vaccine for it, so highly recommend if you're working in EMS you get that so you don't have to worry about Hep A. Hep B is the more dangerous one of the Heps. Same symptoms, nausea, vomiting, abdominal pain, jaundice. The younger patients do not have symptoms but they'll develop the chronic problems. So they'll have liver failure in the end. Transmission for Hep B is usually in blood products or other body fluids, semen, cerebral vascular or cerebral spinal fluid, amniotic fluid, vaginal secretion. The bad part about Hep B is the virus is pretty tough. It will stay active in fluid up to 2 weeks after it's exited the body. Typically, viruses needs a live host to stay active, but this one will hang out for a long time waiting for a new host to show up. No treatment, but you do have a vaccine. So get the vaccine, use good PPE, post-exposure, soap and water, and get to your healthcare provider so you can get the gamma-globulin. It is a nasty injection. They give you about 50 cc's, 25 in each hip, and it's kind of the consistency of maple syrup, so it hurts. But it's better than catching Hep B. Hep C is very common. It's just acts just like Hep B, but there's really not any treatment for this one either. It's just a different version of the virus that infects you. It's blood through shared needles. Less common. It's more common through blood products than less common through intercourse or childbirth, so it's not as prevalent in semen or vaginal fluids. They have medications to control it, but not to treat it. So best thing you can do is standard precautions and use proper disposal of sharps. Make sure you put the sharp objects back into the proper disposal containers that won't give you accidental needle sticks. HIV and AIDS hasn't had a lot of publicity lately, but it's still out there. Flu-like symptoms, and then gradually progresses to opportunistic infections because it destroys your immune system. So you get pneumocystis carinii, couples of sarcoma, tuberculosis. These diseases see the opportunity because you've got a compromised immune system and start attacking the rest of your body. There's the Kaposi sarcomas. They're skin cancers. They're cells that just develop on the surface of the skin and cause some severe problems for you. Transmission, shared needles, unprotected sex. The book says between men, but it goes every direction, and we don't care what gender you identify. If you go have unprotected sex with somebody that is positive, you will have a higher risk of transmission. Anything that penetrates with blood. I knew a paramedic in Missouri that caught it from a contaminated needle. So very important to use good precautions when you're working with patients, any patient, because you don't know what diseases they may have. Deliveries, breastfeeding also transmit it because it's in the body fluids. So if you take the precaution, if it's icky and sticky and not yours, don't touch it, you should be good. They do have lots of medications that reduce the viral load of HIV. There are people that have been living for a long time with HIV and not having any symptoms or having any concerns. Most famous one I remember from the 90s was Magic Johnson. He contracted HIV, quit the NBA, and he is very active, and you never hear about HIV from him at all. So some prevention is your standard precautions. They do have some programs within health departments where you can pick up free needles and dispose of used needles and try to prevent this needle sharing. Maybe I should become a drug user and I can get free needles for my insulin. They promote condom use, try to make sure we have safe sex. If you have exposure, wash the area with hot soapy water and call your healthcare provider. Do your exposure documentation and make sure they do some testing for you. Flu. It's a viral illness. fever, non-productive cough, muscle ache, sore throat, headache, severe weakness, nausea, vomiting, all kinds of problems there. But if you use good hand washing, stay healthy, and get your vaccines, you'll have a much lower, much milder response to the flu viruses. So it's common thing is the fever. Biggest thing with fever is maintaining control on the fever so you don't get too high for the kids. Make sure your people are drinking plenty of fluids so they don't dehydrate. It's mainly spread through droplets or direct contact. So with droplets from your respiratory system, a good way to prevent this is have anybody that may be sick put a mask on. So when they do cough, it doesn't spread the virus. And that sounds like a good idea if they have maybe COVID. Put mask on these sick people. Antiviral medications reduce the severity, but they don't get rid of it completely. Best thing to prevent it, hot soapy water. Learn to wash your hands. Some type of protective mask and the vaccination when it's available. Croup or HPIV, parainfluenza virus, human parainfluenza virus, and that laryngotracheal bronchitis. Signs and symptoms: inflammation, swelling of the larynx, trachea, and bronchi. It's mainly from young kids that's 6 months to 3 years. Have an upper respiratory infection that produces that seal-like bark. Usually gets worse at night. The ER doctors that I talk to, they say they rarely see this, but when they do, it's pretty critical. So it's one of those once or twice a year patients, but just be aware of it and know how to treat it. It is also transmitted by coughing and sneezing. So you're going to get there. Kids going to have shortness of breath. We know how to treat shortness of breath. We give them oxygen. And then the prevention is good hand hygiene. Wash your mouth and don't touch anything that touched the kiddos. Whooping cough. Now this one's a bacterial infection, upper respiratory. It's a whooping sound on inspiration, so it's a weird one with the kids, but it doesn't happen a lot. There's a vaccine for this one, so most kids are not getting this one. It's large droplets in the air. Again, put the mask on the kid if they're coughing. Treat it with antibiotics and wash your hands. Pneumonia, fever, chills, shortness of breath, tachypnea, pleuritic pain, productive cough, inflammation on the x-ray. We don't typically get x-rays in the ambulance, but potential febrile seizures in kiddos, altered mental status, signs in the elderly because of the hypoxia. That's what the lungs look like. You can see the inflammation by the dark areas, or the lighter areas down here in the bottom. That's the infection that you see there. It's spread by droplets, but needs close contact for several days. It's not easily transmitted. The most common place you see people get pneumonia is in the hospital because they're with other people that have pneumonia, and they're weakened. Their bodies are weakened because of their other diseases or their other injuries. Treated with antibiotics if it's a bacterial infection. Viral or fungal pneumonia, a little bit more difficult to treat. They do have vaccines for pneumonia, but biggest thing is hand washing and staying away from people. Cough etiquette: cough into your shoulder, into your elbow. Tuberculosis, dry cough, maybe producing sputum, fevers, night sweats, weight loss. I think I posted a video on YouTube of Doc Holliday from Tombstone. He was a tuberculosis patient, and they've done a real good job of producing the symptoms pretty accurately with him. Spread by coughing, singing, or sneezing. So if your patient starts singing, ask him to quit. treated with antibiotics. It is a bacterial infection. Colorado Springs used to be one of the major places that they treated tuberculosis because the high altitude and dry air made it much easier to treat. So some of our history is being a tuberculosis location. You can have a vaccine for it, and just use your airborne precautions. So put a mask on them. Meningitis, abrupt onset of fever, nausea, vomiting, headache, nuchal rigidity, neck rigidity, photophobia, the bright lights bother them, possible petechiae, the little breaking in the blood vessels in the face, get that little rash. A friend of my son's had meningitis, and it was so severe that he had to go through, he had long-term brain issues because of the infection of the meninges in his brain. So it's one of those things that we need to identify and get their treatment as quick as possible. You see that petechiae rash? That's kind of the broken blood vessels. That's something else you're seeing with COVID now too, is the breaking of the blood vessels. Spread with direct contact, depending on what the source of the infection is. You can treat it with antibiotics, antivirals. They do have vaccinations. They highly recommend kids going to school to live in dorms or Greek housing. Get some type of vaccination before they go so they don't have to deal with this. STDs. Hopefully this is not a patient issue with you, but just in case, we'll talk about it. Viral STDs or Hep B's or hepatitis, A, B, C, or D, HIV, genital herpes, and HPV. Bacteria would be the chlamydias, gonorrhea, and syphilis. What we want to do is identify what the potential risks are and use the appropriate precautions. We do have vaccines for some of these, so we want to make sure that we're getting as much vaccination as possible within what you're allowed to make sure you're protected. If you are, you need to have protected sex with anybody that you do not know the history of. STDs are not a common call for 911 except for PID, pelvic inflammatory disease. Patient gets gonorrhea or chlamydia, they have a very distinct walk because they've got an infection that's very painful in their genitalia, and so it's called the PID shuffle. It's hard to describe, but once you see the patient walk and you get a little history, you'll know what it is. Usually a lower abdominal pain, sometimes vaginal discharge, depending on how bad the infection is. You may have diseases caused by ticks, Lyme disease, Rocky Mountain spotted fever, two big ones here in Colorado. They treated with antibiotics. So anytime you're working out in the search and rescue areas, or you bring in a patient, make sure you're checking for ticks. It's not a 911 call, but it's something you need to do for your own protection. Remove the tick with tweezers, get the head out. Emerging or newly recognized infectious disease. Turn on the news, listen a little bit, turn off the news, and now we'll talk about it. In some cases, antibiotics that used are no longer effective. Moms that run to the doctor every time the kid gets a sniffle and gets an antibiotic. The antibiotics go into the system and the bacteria says, oh, that's a bad deal, and eventually mutates so the antibiotics don't work on them anymore. So we're getting several bacteria or antibiotic resistant bacteria because of overuse of antibiotics. Another problem with antibiotic overuse is when you take it and your body doesn't use all of it and it goes into your wastewater system. Wastewater treatment does not remove the remnants of the antibiotics. And so the next person down the stream, when they get their drinking water, they get the remnants of that antibiotic. and so now you get some immunity, or you get some exposure there, and you start having more antibiotic-resistant bacterial infections. Use standard precautions, gloves, mask, good hand washing, and you should be good for most new diseases. As things progress, we'll look at the way to protect ourselves even better. Some of the more recently discovered ones: HIV or AIDS, SARS. COVID-19 is a SARS, severe acute respiratory syndrome disease. It is part of that group. Ebola virus, that's another one that gave us some scares for the last few years. Middle East respiratory syndrome, or MERS. Zika virus, that was a big deal during Hurricane Irma. When I went down to Florida, there was a lot of concern that we were going to be exposed to mosquitoes that had Zika virus. And then COVID-19, we've been overexposed to the information on that one. If the outbreak occurs, remain calm. Do not worry. The news reports may exaggerate the extent of the number of ill or the ease at which the disease is spread. Yeah, I better run some Facebook checks on that one, because I don't know if that's true. Follow the recommendations of the CDC and your local health department. I read those to you because use your brain, do your research, and figure out what's best. Work with your medical director. Our El Paso County medical directors have developed our standards for responding to COVID patients based on their research, a combination of the CDC, local health department, state health department, and other sources. And they've worked to make sure we're protected the best way possible. And you need to trust them with their process. So, any questions? Come to class with them. Let's have a chat. Thanks, and have a good night.